Hello. Uh, Greetings from Population Foundation of India. My name is Irfan Khan, and I manage the family planning component across all programs at PFI. And it is my pleasure to welcome all of you to this national e-panel discussion titled Charting the Way Forward for Expanding Access to Contraceptive Services, organized by PFI in collaboration with UNFPA India on the occasion of World Contraception Day, which was on 26th September. Before I hand over the stage to Ms. Mitali Mukherjee, who's the consulting editor for The Wire and is the moderator for the discussion, let me briefly lay the agenda. So in a few seconds from now, Mitali will set the context and introduce our eminent panelists and dive into the discussion, which will last for about an hour. It will then be followed by the e-release of a white paper by Population Foundation of India on choice-based family planning approach to family planning. Then we'll take as many questions possible in the time allotted for it, which will be around 20 minutes. And then we'll close the discussion at 5 p.m. So I once again thank all of you for making the time to join us. Over to you, Mitali.
Irfan, thank you so much for that. Before I begin, a request for all our panelists who are present in this conversation to unmute themselves and put their videos on as well, so that everyone who's logging in can see what a fantastic panel we've got and what a great conversation we're going to get going. I don't want to take a lot of time explaining things, but because as is evident, there's a wealth of expertise all around me. I'm probably the least informed in that scale, but I just wanted to put a couple of talking points into this conversation before we get started. As Irfan pointed out, 26 September is World Contraception Day. Very simply put, we're talking about enabling women and young people to make informed choices about their sexual health, about their reproductive choices. I think what's important in this context is that slowly and slowly the conversation is gravitating to the fact that making a choice about reproductive health is actually a human right, and that's a right that every woman should be given, every young girl should be given. It's not up for debate anymore. I am essentially a business journalist and I'm drawn to data. And I read some data which was frankly quite worrying for me. And I think all my guests here will have a lot more nuance to give into that. The first one is that a recent survey by the World Health Organization, WHO, found that family planning and contraception are amongst the most frequently disrupted health services, with 7 in 10 countries experiencing disruptions. I mean, just let that sink in. It's not about developed versus developing. 7 in 10 countries struggle with this. The other important piece of data that I came across was a study by UNFPA, Johns Hopkins University, and a couple of others, which found that the first 6 months, just the first 6 months of severe health disruptions because of the pandemic, have caused havoc in 115 low and middle income countries, leading to perhaps, that's the figure that is estimated at this point, 7 million unplanned pregnancies. This is not a data point. These are people's lives which are impacted. These are people's choices which are being impacted, and their freedom as well. I want to throw it open to this fantastic panel, but I'm going to take a minute to introduce everyone so that you have a sense of who you're seeing on the screen and where they're coming from. First up is Ms. Argentina Matavel. She is resident representative for UNFPA India, country director for Bhutan. Of course, she served in several other countries, including Bangladesh, Mongolia, Botswana. She's occupied various leadership positions in World Vision United States and in Mozambique, and she's been working for UNDP both in Burundi and Mozambique. It's a 40-year career which comes with a wealth of expertise, I'm sure, and she's been at the forefront of programs that talk about the rights of women and girls. Mrs. Poonam Mutreja is the executive director of PFI. Of course, they're the ones who've really taken it on and organized this initiative today. So thank you for that, Poonam. She's worked in the field of women's health, reproductive and sexual rights. She's worked in the rural livelihood area. She's also been at the forefront of public advocacy about this. And she conceived and launched the transmedia initiative called Main Kuch Bhi Kar Sakti Hoon. Translation in English, I as a woman can achieve anything. She's also been the country director of MacArthur Foundation in India. Poonam, thank you for organizing this first, and thank you for being on this panel. I move then to Dr. Alpesh Gandhi, who is the president of FOGSI. He brings with him 30 years of experience in high quality treatments. And I think that's really going to be the crux of this conversation, both in obstetrics and in gynecology. He's been working with the government as well. In that regard, he has been conferred the honorary fellowship of the Royal College of Obstetricians and Gynecologists. And there's an important book that he came out with called Principles of Critical Care in Obstetrics. So for anyone who would like to go deeper into this subject, that's a book that's been written by him. Last and certainly not the least, Ankita Khanna joins in as well. Welcome, Ankita. She's India Country Coordinator with the International Youth Alliance for Family Planning, which I think is going to be a strong pillar of this conversation, because this subject has to move to the youth, and it has to be about empowering young women and men actually to make informed choices. She serves as a member of its task force on safe abortion. She's an advocate of open knowledge, equitable representation, and of course, fostering leadership and representation amongst adolescents and youth. And she's been working on multiple projects in that regard. So welcome all of you. I'm sure it's going to be an extremely deep and wide conversation, and I want to hear from all of you. Argentina, if I may start with you, and I want to start with a slightly technical number, but I think within that technical number, there is a story in itself, which is a notable statistic which we often use called the total fertility rate, basically the desired fertility rate. Also known as, I think for someone who's joining in and trying to understand this simply, a woman's choice in whether or not she wants to expand her family and how many children she wants to have. I'm just looking at our rates in that regard, where our TFR is 2.2, but our DFR is 1.8, the desired fertility rate. What does that point you towards in terms of the Indian context, really? May I request you to unmute your mic, Argentina? We can't.
Thank you.
Yes.
Thank you very much. Am I unmuted now?
Yes, you are. We can hear you.
Okay. Thank you very much for this, starting with a very important statistic, which is, in fact, behind a lot of the data that we look at in many countries, when you look at what we call the unmet need. So a woman may respond that she would like to use contraception, and yet that doesn't tally with the number of children that she has over the years, even when she has known about contraception. And there are many reasons for that. In many countries, in continents that I've been to, one of the biggest reasons lies with societal norms. How is the woman valued? Oftentimes in many communities, she's valued by the number of children, especially sons, that she bears. So even if the husband would have been, or the family, happy with 5 children, if she has not born a son, she will continue. So that is her perceived obligation to society, to the family she was married into, but also because she's protecting her own, space in society. And then we have the issue of counseling, of course, because sometimes unless we counsel women properly, they only see one method. For example, in India, when you look at the statistics, sterilization occupies a very, very high percentage of all methods. But not all women are safe or want to use such a permanent method. And so unless the counseling by the health worker shows her or gives her more options, either an injectable or an IUD or a pill, a condom, then she doesn't have an option. She thinks that at the facility, that's all she can get. The third one, even if she has good counseling, is that she may not have the agency to make a decision. The NFHS shows that a good 25% of women have no say in issues of healthcare, and let alone in contraception, on her own fertility. That's the family that controls. And so these are issues that are there. I spoke about, I mentioned some preference in determining the continuation of childbearing, even when she already attained the number that she thought would have been enough for her. And hence, it's very important that any health system and us, the development community that work on these issues, that we really look into all these factors and invest on multiple fronts. While availability is one, the counseling, the basket of choice, the social and behavioral thinking and beliefs, the perceptions. So we have to invest on all these multiple. So I'll stop there for now because I'm sure other distinguished speakers will have more to say.
Thank you for that. That's great context setting. Poonam, let me swivel to you on that point. Already from the data we have, the unmet need for family planning is at a double-digit percentage. God knows this pandemic has probably skewed that number to an even higher rate. Argentina made an important point about the social construct when we have this conversation, and layered above that, of course, is the state or the government and its role. What's your sense of where we are at that point, and what's your sense of what kind of government initiative or intervention we've had so far?
So I'm sure you're asking me this question on government intervention because Dr. Sigdar and other officials are not here. So I'm happy to respond, just stating facts. It's unfortunate that Dr. Sigdar, who was to join us as per the suggestion of the Additional Secretary Vandana Gurnani, could not join us because he's very sick. So let me start by saying we wish him all the best for improving his health, and he sends a message regretting his absence here. So as far as the government goes, there is a recognition that there is an unmet need. And the government did start a program in 2016, I believe, yes, 2016, called the Mission Parivar Vikas. Mission Parivar Vikas focuses in 146 districts, which are the high fertility rate districts, and they're mainly North India, where other indicators are also very poor, like women's education, the health status, caste, income levels, and so on. So the government also, I'd like to say, recognizing that there was a huge unmet need for young people. India's population momentum is fueled by 70% young people who are at a reproductive age. So the government, rightly after 30 years, introduced 3 temporary methods a couple of years ago. And unfortunately, while they've been introduced, there is a lot more that needs to be done. And we already had a huge unmet need, as was said by Argentina, 13%. And now, with COVID, tragic as it is, has increased. And there are many reasons why the unmet need has increased, or lack or contraception choices that women would like to exercise are not available. And it's a combination of the fact that the government got very busy with dealing with the pandemic. But having done that, I must acknowledge that the government, when it was alerted by many of us, including Argentina and others, the government immediately included family planning as an essential service. But the problem is that there is very little opportunity to give services given the pandemic. And also people have not gone for health services other than emergency health services because they have this fear of getting COVID. There has been introduction of some behavior change communication too by government. There has been a very, concerted effort, but then India's a large country, and COVID has certainly set us back. If you look at OCPs, if you look at even NFHS data or HMIS data, if you compare the March, April, June data of 2020 to 2019, you will see the numbers are staggering, and it is frightening to think what women and families who did not wish to have, especially during the epidemic, additional or newborns. We are unfortunately going to have 20 million births according to UNICEF in India in the year. So I do believe that India and the rest of the world too, we need to plan better for pandemics and so on. And perhaps an element of self-care needs to be introduced. People going to, okay, I'm coming to solutions, which you probably is not what you're expecting right now. So let me just say that while there have been attempts, but we need to measure what is working, what is not working. And that is one situation about our family planning program, which is the oldest program in the world, where we need to figure out what is working, what is not working, and then make improvements on what is needed.
Sure. Dr. Gandhi, that's an important point, and I want to also draw back on the point that Argentina made about a certain narrative that exists, which is that there is only a binary solution here for family planning or for making sexual choices. I want your thoughts on the benefits of long-acting reversible contraceptive methods, whether we're talking about injections or IUDs or contraceptive implants. A, how much awareness is there? And B, do you think they have the capability to penetrate into the system deeper and more efficiently?
Where did you go?
Dr. Gandhi, is my voice reaching you? Yeah.
Good afternoon, Mitali. And first of all, I bring greetings on behalf of Foxy, and I would like to congratulate Poonam Mutreja and PFI for organizing this very useful webinar and inviting me as one of the panelists for this webinar. Thank you very much for the invitation. I fully agree with the views expressed by Argentina and Poonam. As the pandemic COVID-19 spread, many countries implemented tough lockdowns, travel restrictions, so many policies to beat a slow transmission. And because of this, as we all have discussed, the essential services or time-sensitive services and these contraceptive services are hampered. Many private clinics had shut down because of transport restriction and non-availability of staff or supply chain disruption. So many problems were there. And yes, I fully agree. I fully agree that the statistics, UNFPA predicts that there could be up to 7 million unintended pregnancies worldwide because of this crisis and the steps taken. And at the same time, UNICEF has estimated nearly 20.1 million unexpected births. India may be the highest across the world. And IPAS has estimated that in India, in the 3-month period of lockdown, access to 1.85 million abortions is likely to be compromised due to this combination of factors. But I think I would like to inform all of you that Foxy in India, Foxy was the first organization who came out with this short advisory for its 38,000 members. And we have published our first short term advisory to our members on 17th of the March, and second advisory we have published on 27th March. And we have advise all our 38,000 members to continue the essential health services like maternity services, contraceptive services, and time-sensitive services like abortion services. So I am happy to inform that in India, Foxy was the first federation to come out with this clear-cut guidelines for its members. Now, coming to the your question, I would also like to say that this pandemic has taught us so many lessons. We do not like to learn lesson in this way, but of course, it has shown that certain things are hampered, but at the same time, we can say this shows the need for greater number of measures, focusing on measures with long-term protection, with same efficacy, same safety, and also confirms the self-care concept where client is counseled to care for side effects and is counseled about all these aspects. As one-time visit or teleconsult may suffice for the service provision. This pandemic has also introduced telemedicine concept in India. And I think consultation now continuation rates are also is higher with this LARC, and efficacy is same as sterilization in many instances. Private sector has seen expansion of basket of choices this year. So implant is also there, has been launched in more than 5 metro cities, and Foxy has been instrumental in training of more than 200 doctors. So we have found good acceptance of implants. Also subcutaneous DMPA are also successful. So in one way we can say we have so many problems because of COVID-19, but at the same time we are there. It is our responsibility to find the solutions and to solve the problems. And I think long-acting reversible contraception is the one way how we can help our patients, how we can help a younger generation, and how we can tackle this problem.
Sure. Let's draw down on that very important subset, which is the younger generation. Ankita, now there's differing data. Some data suggests that the urban youth are actually sexually active at a much younger age now, and they are going out and seeking conversations about contraception because they want to make informed choices. I'm guessing it's not the same situation or choice in the rural subset. Define for us or lay out the lay of the land for the youth as it stands.
Mm-hmm. So it is true that youth are, having sex at an earlier age, and they are seeking out information about this. But do youth have access to accurate information? That is the first question. And is this information? How are they seeking this information, through peer groups, or are they going through informal channels? So, and creating that provision, this has been a historical conversation that has been, highlighted, that youth and even older adults should have access to accurate information on contraception and family planning. But it's still not been fixed. In our education system, through government programming, even civil society programming, there is a lot to be done. So I think that is an area that we should consider. Given the COVID pandemic, I think COVID highlighted the disparities that exist between urban and rural youth, and the financial background that you
We just snapped the connection with Ankita. I'm going to go and try to go back to her in just a second. But Argentina, I'd love your thoughts on the same issue, which is sort of engaging with the youth and getting them in this conversation. There were examples through the pandemic, for example, in France, where contraceptives were home delivered free of cost to women who wanted it. There are examples in some developed countries where school children can walk into the nursery or the infirmary and have access to contraceptives if they like. What can we do to broaden this chat for the youth?
Sorry, could you repeat the last question?
Yeah, Ankita, I'm going to come back to you in just a second. Okay. I wanted to get Argentina's thoughts in. And
okay, sorry. No, that's okay.
Yeah, Argentina, please go ahead. I think you need to unmute your mic.
Oh, sorry. Thank you. I was saying it would have been really interesting to go after Ankita, because she works among the youth, much as UNFPA works with young people, but she's with the Youth Alliance. But looking at the examples that you gave, remember that we are in a much more conservative society than the example of a country like France or the Nordic countries or the United States, where young people can freely go either to a health post, to a pharmacy, anywhere. They can get the supplies when they want to. They know about these things much earlier. We're lucky that in India, the government accepted to roll out life skills in education settings, which include comprehensive sexuality education, which UNFPA works very closely with. Now, there are, even with all the knowledge they might have, how easy is it for young people when they finally have their sexual debut, which, as you said, it's coming much earlier than in the old days. Also because they don't want to necessarily get married, but it doesn't mean they're not having sexual encounters. You have television, you have, all sorts of information that, make, and the development itself, the times have moved. And especially in urban settings, young people are wanting to be in control of their bodies. They are not necessarily waiting for some marriage to come by. They may not even want to get married. Well, how can we get to them, make sure that they have the methods that they want actually to prevent an unwanted pregnancy? There are many ways. I think Dr. Gandhi mentioned telemedicine, for example. That's one way because it's a new technology. It provides relative confidentiality, which young people want. They don't want to go to a facility where the lady is an aunt or a cousin of mom, or, and even if they are not aunties and cousins, they look them in a funny way. Why are you married? And, asking inconvenient questions. And so while we can work with the health providers on that, it takes a little longer. So we can try to get other methods. We can get pharmacists, for example. Many young people just go to pharmacies and get the morning after pill. But what if we would work with the private sector, which the social marketing surveys that we have show that actually that's the way to go, and examples elsewhere. You can have pharmacies, you can have other places that would sell. If I walk into a store in the United States, condoms are sitting right there. I mean, nobody will look at you funny because you picked up a condom because you are 16. They even applaud that a young person is picking up a condom to protect themselves. And so all these ways we need to target universities, services for universities, because that is where they are already, really at that age where, they're either about to get married or they have longer term relationships or they're engaging. But even information in high schools, upper high schools, while the comprehensive sexuality education is in the upper primary and lower secondary, the actual services are not there. So it's important to link that information to the actual access to services.
Sure.
And in India, that conversation becomes a much more important because we have, I'm not even talking about all the people of reproductive age, as Poonam mentioned, just the young people up to 24, you have about like more than 350 million, 350 million. I mean, it's no headbreaker, right? If we want to reduce maternal mortality further, because family planning contributes 30 to 40% in reduction of maternal mortality alone, because the woman or the girl are not getting pregnant in the first place if they're using a contraception, right? So getting that maternal mortality down, in reducing the unmet need, we have to get to this population cohort. When in the marriage halls, we could have little cards where the officiating official officiating the marriage would offer a little booklet or a little something that tells them about family planning, where to access the services, just basic. I'm just mentioning a few, but it's important that the public sector really steps up in terms of walking with the times. Thank you.
Ankita, I'm sorry you got cut short. We were just talking about, what examples exist out of the country, but please do finish your point about, what you see and what, more importantly, you see as solutions.
Yeah. So the point that I was making was that COVID has highlighted the disparities that exist with the privileges that different people carry, not just youth. But there's a disparity between urban and rural youth, and there's a certain social capital that you carry, and there's the privilege of having access to information and the privilege of being able to isolate yourself during a pandemic or seeking healthcare services. So these issues have been highlighted, but these issues also give us an opportunity to examine what were the gaps and to find solutions to these problems that have been highlighted. And I think that is the point that I was making towards the realities that COVID has revealed and what we can do about it. So this is an opportunity, actually, as sad as it is, to find solutions to these problems.
Poonam, Argentina made the point about how the civil society can come in and play a greater role at this point. That's really where you sort of segue into this conversation. What do you think is the role, and how important do you think it is, given the kind of statistics we just talked about in terms of youth and young women?
So, civil society organizations have historically played a big role in family planning, and much of that role was played initially in providing services. And I don't believe that that is the only role of family planning organizations. If they wish to provide services, wonderful. I am not saying it's a bad thing. But let me point out some areas where NGOs, you have to work in sync with the government. You have to see what are their strengths, what are their responsibilities and obligations, and then calibrate a role for NGOs. So one area where I feel NGOs can play a huge role is on ensuring that women have agency and the decision-making abilities, opportunities to take decisions. With family planning, there are a lot of myths and misconceptions. Family planning services may be available, but it does not mean that women who need it the most, especially the illiterate, the most poor and backward, will have access. They have family planning access is where you live, how much you earn, and how educated you are. There's a huge close correlation between education and the number of children a woman will bear through her childbearing period. So women's empowerment, getting access, getting more men engaged. In India, it's seen as a woman's responsibility to have the babies, to take care of the children, and to bear more children than she needs, or not have the agency to practice family planning. And we need greater conversations between men and women, and we need in the families or partners, and we need greater male involvement. And I do believe that that's one area NGOs can play a role. Another area is what Ankita referred to, sex education for young people, which is in India, young people have more access to misinformation than information on reproductive and sexual health. And that is very important given the number of abortions. But given that, why should a young girls or any woman have to go through an abortion when contraceptives are available? Abortion should be an absolute right, but abortion should not be exercised due to failure of availability or agency to use contraception. This is another area where I think NGOs have a huge opportunity. Look, we do have a culturally sensitive, as it should be, but culturally sensitive political environment where sex education is not accepted as something the schools should do. So while we wait to convince our political leadership and those who are opposed to sex education, we have this great opportunity to use the digital media. A large number of young people use digital media today, and I'm talking about not just internet, I'm talking about telephones and WhatsApp and all these messages. Now, what we can do using technology is tremendous on sex education, and PFI is doing it. And this is not a panel for talking about PFI's work, so I will not talk about it. But using digital technology is a great opportunity. We have a program called Sex Ki Adalat, for instance, where young people looking for sex end up getting sex education, sexuality education, which is a clever name, I think, bringing sex into it. But it's not about sex. It's more about reproductive health rights and, family planning and various other aspects which are all related to sex. So I feel that now many people will say to me, and I'm sure there's already a question, people will say, hey, but what about all those young girls who do not have access to phones and technology? While we worry about that, let's reach the ones who we can reach. Fourth area where I think NGOs can play a big role is behavior change communication. And I think we are playing a role in that. Many NGOs have very creative programs at the global and national level. And we partner, in fact, and have been supported by UNFPA. And I know that even Foxy has made materials on, has made film recently, I saw, on access to contraception and contraceptives. So this is one area, and we can get creative juices going, get creative industries to work with us on behavior change communication, demand generation, and finally, I would like to say that NGOs can play a really big role in looking at what works, what doesn't work, research, evaluation, monitoring, and giving feedback to the government. In the absence of government doing evaluations, NGOs can constructively give feedback to government. And I do believe there's an openness if it's evidence-based. Our experience with the government has been very good.
Dr. Gandhi, let me get you into the other part of the conversation, which is the actual rollout of implants. And I want to take you back to that 2016-2017 period when the government of India, it was a government-funded contraceptive, MPA. A, what was your experience there? And B, we've heard so much about the role of the government, of civil society. How important do you think the role is of an individual doctor, who is often the first point of connect for a woman who's going to have a conversation about, sexual health or reproductive choices?
First of all, I would like to make a comment in continuation of the discussion going on that India is the youngest country in the world, we can say, and 11% of the world teenage pregnancy happen in India. And early marriages are also incidence is very high in India. So it is very, very essential for all of us to work on this platform. I would also like to discuss, because as you have asked the role of Foxy, so I would also like to share one experience that recently on World Youth Day, we celebrated the day for the preventable adolescent and youth healthcare education. And in spite of lockdown, in spite of these schools and colleges are closed, to our surprise, it has picked up like anything, and 121,000 boys and girls have joined for this program, and so many teachers and parents and schools appreciated and supported us, and we have received 10,000 questions. So it was not possible to reply to all of them, and we promised that we will come out with this FAQ. The important thing is the preventable adolescent healthcare education, which involves these problems, teenage pregnancy, early pregnancy, all these things as a sex education, we can say. So I think now what we have decided from their suggestion, we have received this suggestion from the boys and girls that why Foxy is not organizing a workshop for parents and teachers. So now we are planning to organizing workshop for parents and teachers for giving them education regarding all these aspects. Coming to the these implants and Foxy has already endorsed, and Foxy played a major role and can still play a major role. Foxy has published position statement on March 24, 2019. And Foxy endorses contraceptive implants as an efficient, reliable, long-term method of contraception. Foxy believes that implants are a promising, effective method of contraception, and that should be available as an option for contraception. And implant stimulation-based training should be arranged. And we have our Family Welfare Committee. This committee is doing excellent work, and we are doing training program through this committee. So various training programs are conducted by our Family and Welfare Committee, mainly at present in 5 to 6 metro cities like Delhi, Mumbai, Kolkata, Hyderabad, Bangalore, and Chennai. And in each session, we are training more than 30 doctors. And we are, I think we also think that media engagement needs to step up, and regional training is also planned. So I think we have a huge role. Our family welfare committee has a huge role, and particularly behavior change in providers and acceptors can also be checked with the surveys, as Dr. Poonam has mentioned. And Foxy can also be helpful in this behavioral change surveys. And Foxy may plan a community connect program, as just I have mentioned. One of the program was adolescent and teenage healthcare education. Like that, Foxy can plan many community connect program. Just recently, we have one breastfeeding promotion community connect program, which was attended by 52,000 mothers. So similarly, I think this is a time where digital platform has picked up like anything. We should take a benefit of this digital platform, and youth are very easily connected with this digital platform. So this is again, I would say, one opportunity for educate them.
Absolutely. Thank you for that. And Ankita, I want to come into you at that, because remiss of me not to have mentioned this at the start, but this conversation that we're having is not just closed within a community of people who understand the subject, but we are live streaming on YouTube, on the Bio platform. And my hope personally is that there's a lot of young people who've tuned in. I just want to ask you quickly, Ankita, about how, what you think is the best way to attack the myths that surround family planning or reproductive choices. Going on the pill makes you put on weight. Going on the pill means you can't get pregnant later. There's a bunch of misinformation that's floating around there. What's the best way to address the youth, reach out to them and say, you know what, this is fact and this is myth?
I am personally a strong believer in the power of the education system that we have in the country, right? There's great potential to reach a lot of adolescents and youth through the education system. Now, if programming was implemented like it was planned, to give accurate access there to these children without stigma in a safe space, these students, these learners, then they would have access to accurate information from the get-go, from when they start seeking uh, knowledge and information related to sex. And beyond that, I think the government and civil society has taken great steps, given the context, given the stigma within the country, to provide information and resources to young people. But I think fixing that little gap in comprehensive sexuality education is a very important step that we can take to make sure that young people have access to this information.
Yeah. I am conscious of time, and I know that there's a bunch of questions already piling up, but there's one important question I wanted to ask all of you. And Poonam, let me start with you. In an idealistic world, if you had all the decision-making powers, what are the 3 key things you would do to ensure there's uninterrupted availability of contraceptives to whoever wants it?
So I would make access to sexual and reproductive health universal across India. And I would work, I absolutely agree with Dr. Gandhi on the role of the private sector. Family planning is one area where I would like to see greater collaboration between the private sector and the public sector, and that the government every woman should be able to walk in to a public health facility or a private health facility, get the contraceptive of her choice, and the poor who can't afford it or the middle class should be covered under universal reproductive sexual health coverage. Given that, the impact on maternal health, child health, and India's population stabilization goals, we need to do right thing. What we're thinking of doing is the wrong things, like a 2-child norm or coercive policies. Let's make it available, because women in India have demonstrated through government's own surveys that they don't want more than 2 children. And the women can't afford, many of them. Look at the prices of just food. So I would make this universal, universal health coverage. The second thing I would do is to bring every contraceptive that exists in the world, including implants which have come to the private sector, but We want them in the public sector too. Every contraceptive available in the world should be available for women and girls in India. And so the basket of choice should expand. And none of this will be enough without counseling. So there should be counseling available for women. As earlier Argentina had said, they need counseling, because when they go, they don't know the impact, side effect of each contraceptive. They don't know how many contraceptives exist, and they don't know what's good for them. So we really need counseling, because it's a technical issue, contraception. It's like, it's some extent medicine. So I'll stop there.
Argentina, same question to you. I'm limiting it at 3. I'm sure there's, so much more, but what's the 3 things you would want to push through? May I ask you to unmute your mic, Argentina?
Yes, thank you. And Poonam has touched on very, very important ones. But I would say also there are systems issues. I would, for example, provide equal incentive to health providers who are working on family planning for promoting all methods, as opposed to making the incentive for sterilization higher than the others. I would, for example, popularize the whole issue, demystify family planning. It's not only for married couples. The times have changed. So make it popular, make it available, voluntary, but also sustain campaigns, behavioral and social change campaigns with information of where to find these methods for young people. So engaging the private sector, but the sustained behavioral and social behavioral campaign is very important on women's agencies, on availability, on the information itself, informing people, the young people, where to get it. Thank you.
Ankita, you're representing the youth. Tell us what kind of choices they want and what kind of information they want.
Okay, so I think the first point would be to create access to adolescent and reproductive health services without stigma. So there is the culture and social stigma, but there is also this provider bias and stigma. So that I think needs to be addressed. I think there's a lot of research already that exists on addressing this issue. A lot of qualitative research itself, and like Poonam said, that male involvement really helps. In creating a safe space and actually combating a little bit of the stigma, not entirely, but addressing it. So I think that is also one thing. I think this is not entirely for all youth, because youth are not a homogeneous group, but youth who do have access to technology would greatly benefit from platforms and services that allow them digital innovations that would help create access to knowledge and to service providers and to information. So some of those things could come together and address this issue. So I think those are the points. Some of the things that youth want, not all of it, but some of the things. So, yeah.
Dr. Gandhi, I'm coming to you the last, but you're the one who's really been doing the rollout. So this is a question that's really pertinent to you. To ensure uninterrupted availability, what's the 3 decisions you would make?
I would still like to begin with a very basic thing, and that is all need to accept, the society need to accept that it is her choice, it is her right, it is her decision when to become pregnant, how much number of pregnancy, it is her choice, her right, and her decision. First basic thing, everyone has to accept this. Number 2 is, of course, I would definitely go for mass education, awareness, sensitization is very important. Third point is, yes, accessibility, availability with counseling, and here individual doctors have a big role in counseling, I would say. And fourth thing is, I think one cannot do, or one organization cannot do such a big task. We all would have to work jointly. It's a joint effort. It's a partner. We all should have a big partnership, and at all the sectors, as Poonam has mentioned, all public and private, at all the level, we should have the partnership.
That's wonderful. And time willing, maybe I'll come back with a couple of questions, but thank you so much. This conversation could have gone on forever because of how many, sort of tracks it can take within the concept of reproductive health. Thank you. I'm going to just pause for a second before I bring in any questions from our audience, because I think there's an important announcement as well that PFI would like to make. So let me invite back Irfan to make that announcement and present what PFI has been working on. Irfan.
Thank you, Mitali. So I just wanted to talk about the e-launch of the paper that white paper that PFI has been working on. It's on choice-based approach to family planning, which basically looks at family planning and reproductive health from the lens of unmet need. And we all know that unmet need still persists, although there have been advances that have happened in the delivery of reproductive health care. And that is the fact that there is evidence from various surveys that have happened that there is a stagnation of the unmet need, and there are predictions that it's going to grow in the coming years. And then is the disruptions that have happened due to COVID-19 in the delivery of reproductive health services. So it is in this context that that we are looking at the provision of sexual and reproductive health services, and that's where it becomes important and urgent to conceptualize a more revitalized approach to reducing the unmet need. And that's where this paper sort of looks at the choice-based approach to family planning, and drawing from our local experiences and global evidence, we have looked at certain recommendations that can create opportunities for women to exercise their choice. And not only are we looking at this as an opportunity to spread the word, to let people know the issues around unmet need, the effect of COVID-19 and the other factors which have been discussed on this panel, but we also look at this as an opportunity to engage stakeholders, including government agencies, civil society, activists, media, the doctors, the healthcare providers, the frontline workers, women, their partners, and the communities who sort of play a major role in working towards making women access their choices and exercise their choices. So that's in a nutshell the ethos of the white paper that we are taking this opportunity to release today, and it will be available on the Population Foundation of India's website, as well as we'll be sharing it across with all the different stakeholders and all of you who have joined us today on this important discussion. So thanks, Mitali, and back to you.
Thank you, Irfan. Look forward to reading that, and I hope all of us can widely disseminate it. The more information there is, the better, I think, on a subject like this one. Let me dive straight into the questions because I can see that they're really beginning to stack up. Poonam, first question for you. How do we address the resistance amongst women and communities to use birth spacing measures because of religious beliefs or superstitions?
There's somebody on in the audience who should be a panelist, Dr. S.Y. Qureshi, who is best suited to answer this question. I'll take a crack at it, but I would much rather Mitali, if he's willing to and still there, Dr. Qureshi to answer that question. And also, I don't know if he wants me to reveal, but I know he's working on a book on precisely some of these issues, and in any case, the most qualified person to write the book too. So I would you like him to answer this question and give me an opportunity?
Give it a shot. We must give it a shot. Dr. Qureshi, if you're able to unmute yourself and we can all see and hear you, it would be fantastic for all of us to gain from your perspective, sir.
Can you hear me now?
We can hear you.
We'd like to see you.
Oh, I thought I was on YouTube and it was just one way. And yeah,
That's
you know,
technology.
when I heard the conference, and one question which was coming to my mind, because I used to deal with it when I was a DG of NACO, and we introduced sex education in Delhi schools, and we created some very good training materials also, which lasted a few years till there was an uproar in Parliament, and they said, no, we cannot give sex education to our youth. You know, this has been the bane of our politics. They are very shy. They commit all kinds of atrocities on women. They even commit rape, but they would not like our youth to be trained and educated in what is called sex education. We even tried the idea of calling it sex education by giving it a more acceptable name like family life education. The opposition continue to mount. Unfortunately, that is the issue. Second, we had done was, since I have worked with youth for many, many years, as a Joint Secretary Youth and Secretary Ministry of Youth Affairs, Director General of Nehru Yuva Kendra, which had 300,000 youth clubs. And the great thing about dealing with youth was that they were not only the most appropriate target for sex education, but also the best communicators for it. Because through peer group, in fact, sex information we have seen, I have grown up, it only travels through peers. So the best educators are also peers. If we catch hold of some of them, train them, and then let on this, and that is best. But I'm so glad that you have youth participating. You are hearing youth voices. They are the key players in this, and we have to get them on board. Just as they developed a program for HIV/AIDS awareness called University Talk AIDS, when at a time when nobody wanted to talk about it. Similarly, sex is a taboo word. Nobody wants to talk about it. They'll indulge in it, but they'll not talk about it. So I think we must get involved with more proactively, creatively, and let them do something about this. But in any case, I got my opportunity to just share a bit of my
No,
long
no, Dr.
experience.
Qureshi, there was a question that Mitali asked me, and I thought you were more qualified than me to, and a better person to answer that question. So can Mitali, perhaps he didn't hear that question.
The question we've got, from the audience is, how do we address the resistance amongst women and communities to use birth spacing measures because of religious beliefs or superstitions? What do you think is the best way to take that on?
Yeah, the best way is for them to wait for my book, which is coming out next month. In fact, the book is all about that. In fact, it is called The Population Myth, Islam, Muslims, and Politics, Family Planning and Politics in India. And there is a chapter on Islam. And, there I have tried to argue that, religion is totally supportive of the concept of family planning. Spacing particularly, there are 2 verses in the Quran which make breastfeeding mandatory for 2 years. And there are constant references in Hadith about the need for spacing in the interest of health, child health, and unfortunately, nobody talks about it. In fact, although Poonam mentioned about Government of India's good efforts, but I have said in my book that Government of India has made no efforts, no serious effort, because they have not really gathered courage to deal with a sensitive subject like this, particularly after the experience of the emergency. In fact, there was a committee formed by the National Institute of Health and Family Welfare 3 years ago, and I was the chairman, to deal with the issue of political indifference to the issue, that they do not have the courage, and we analyzed that only 0.03 of the parliamentary or legislative questions were on family planning. So they are even shy of talking about family planning. Now, I have mentioned in my book that I have answered all the questions, what religion says. And I said our staff has to be trained in answering those. If somebody says, my religion is against family planning, I will not do it. He doesn't know, he or she is ignorant, and has to be answered. And for that, I have suggested in my book that there should be a resource book. In fact, my book contains all the material for developing that resource book. And that resource book can be, and then who can take it to the community? Because this is the 99% of the Muslim audiences for will say Islam is no, it is not. It is fully supportive of it and give the answers. In fact, UNFPA had come out with a very nice book in 1992 by Abdul Rahim Umran of Al-Azhar University. I have made the phenomenal use of that book throughout the 3-4 decades. It's a wonderful book, and we need to disseminate it more. Thank you.
Sure.
I don't know whether I answered it, Poonam.
Yes, you did. You did, absolutely. Thank you. But Poonam, let me ask you to add into that, because India is a melting pot of many religions and many superstitions, So what is your own experience been?
Yeah, so on Islam, the only thing I would like to add is that, looking at the data, not Islam, he's talking about Islam, Muslim growth rates, that in the last decade, the Muslim growth rate decline, the Muslim decline in growth and numbers was the highest amongst any community. So this myth that Muslims have more children and continue to have more children than other communities is not a correct information. In fact, the biggest myth I'd like to blow, and I always take an opportunity to do so, thank you for giving me an opportunity, Mitali, is that when you take parity for education and income, literacy rates and income, there is no such thing as any religious growth. It is the same. The poorer you are, the less literate you are, you'll have equal number of more children. The better off you are, the more literate you are, you will have fewer children, and it cuts across religions in India and other parts of the world. That's one myth that I want to distinguish. The second is a myth that I want to understand, and again, I hope Dr. Qureshi has dealt with in his book, or maybe, Argentina, where UNFPA is the organization in India that did shine the torch on and call out the adverse sex ratios in India. So they really took the lead. Why is it that there are much better sex ratios amongst the Muslim community compared to other communities in India? And I have not quite totally understood. I believe the only conclusion we can do, and I've said it, is that they care about their girls. They do not, they don't discriminate against their girls. Finally, there's a myth I'd like to deal with, which is all related to men. So men in India practice family planning. As far as contraception is concerned, only vasectomy. Only 0.3% Indian men practice vasectomy, while 75% of Indian women practice, go through sterilization. What is the myth that men live with has to be demolished, and we all have to really work together in demolishing that myth, which is men think their virility will decrease if they get vasectomy. Two, there is this, so that is a myth I think has no scientific base and even evidence. I'm not a man, but I would like this myth to be dealt with, and it is an absolute, total myth.
Sure. I'm going to move on so that I'm not accused of not taking enough questions. Argentina, there's a question that's come in for you, which is, how can parents and teachers be made more aware about sensitively dealing with children and adolescents who don't have filters on the information available to them? How do you control, what they're exposed to? How do you start these conversations at home in a healthy manner? Any sort of pro tips over there?
Thank you. First of all, it's very difficult to control what children will have access to in today's age of the internet. So they will have access to all sorts of misinformation. So it is now incumbent upon the parents and the education system, and/or fault of the education system. The parents, we have to work with parents, educating them also, helping them, either through, for those parents who have children in school, through the meetings in school, we have to make these materials of the comprehensive sexuality education available to parents, because many parents also do not know how to discuss these things, number one, with their children, because it's usually a taboo. But the fact that they have had children doesn't mean they know everything that needs to be known around those issues. So they also need help understanding the issues scientifically. And so at the school system, it's the easiest way, because the majority of the children are in school. And so we can access those parents through the system. But then the behavioral and social communication can also address the issues of taboos and myths, and helping parents understand that unless they have dedicated discussions on these issues with their teenage kids or adolescents, then they will get the information elsewhere. And if they're not comfortable, in many families, in some cultures, they will ask an uncle or an auntie to discuss with the kids. But it's important that it be addressed. Otherwise, you don't address it, they will get it from somewhere else, and may not be the best information out there. Thank you.
Absolutely. Ankita, there's a question for you. How do youngsters overcome the stigma and judgment surrounding the purchase of contraception in stores and, in medicals?
Yeah, I think the burden should not be on youth to overcome the stigma, but on service providers to treat them respectfully when they go to access these services, right?
Yeah.
So service provider trainings should be something that should be thought about, maybe a civil society initiative, or maybe, I don't know, just some information should be given to them that, when youth come to seek information from you, then please. So there's a difference between India and in other countries. If you go to another country, say for example Germany, if you're buying
Oops, I hope Ankita gets back in a second or so. We'll just wait.
We lost Ankita. Oh, only youth.
Okay, I think she's back.
Ankita, we need you back.
I'm back. Just one second. I got kicked off. I wanted to really make that point.
Yes, please go ahead, Ankita.
So what I wanted to say was that if you go and seek information, you want to buy a morning after pill in India, and the same thing you want to do in Germany. In Germany, the service providers give you that information. They tell you, they ask you questions. They make sure that you're getting the right pill and at the right time. And they give you a bit of a counseling. And that should be something that happens in India as well, right? But that's not the case. I've been to both countries and I've bought a pill in both places just to inform myself, and it didn't work. In India, I was faced with stigma and unnecessary questions. So that should not be happening. So the onus should be on the service providers themselves, I think.
No, absolutely. I think that's a great point. It's a cultural context, right, Ankita? Even in India, in most medicos, when you go and buy a packet of sanitary napkins, it's wrapped in newspaper, then it's put into a black bag so that, it's completely camouflaged and hidden. Whereas it's the most normal sort of, bodily function that we can think of.
Right.
So many questions. I don't know if Dr. Qureshi is still here, because this loops back to the point that was being made earlier. If you're still there, sir, there's a question saying, why aren't we talking more about contraceptive options for men besides vasectomy and condoms? I mean, there are injections, there are gels available in various countries. Are we talking enough to the men about this entire issue? And Dr. Qureshi, if you're still there, I'd love to hear your thoughts, and then I'll swivel this to the
No,
other hand.
apparently he's not there, Ankita. He's not there. Mithali, he's not there.
Yeah,
Mithali.
would you like to take it on, Poonam?
The question was, sorry.
The question was, why aren't we talking to men enough about the options available? Why are there only two options, which are vasectomies or condoms? There's nothing in between.
Yeah, so, there is, I'll quickly answer, but there is Dr. Alok Banerjee, who would be a good person who's done a lot of work in this area. And he's online. Just check he's online. So I'd like to say that men, because women are the multitaskers and women are the entire responsibility of the household. And they do both work and take the household responsibility. And it's family planning and giving birth to children, looking after, as I said earlier, is seen as a women's issue. It is, we have to really push home the point that family planning is much as a women's issue. And just because women have the privilege and advantage of being able to do the miracle of giving birth to babies does not mean that every responsibility falls on them. In fact, we should celebrate the huge advantages that women give to society by continuing, families by having children. I think men need to take a whole lot of responsibilities for childcare and family planning. I think it'll be, not only will there be population stabilization, but women will not have to go through unwanted, unexpected, unplanned pregnancies and abortions.
This actually ties in really well with our next question. Argentina, if I may request you to answer it. The question is, does gender orientation in early years play a role in shaping the way access to health services will be used later in life?
That's a very interesting. I hope I understood it correctly. Gender orientation in the early age is shaping how you access contraception.
Yeah.
Absolutely, because, remember that, as Poonam was saying, the reproductive role, which includes both contraception, childbearing, child rearing, and even passing on knowledge from family to family, falls upon the woman. So she has the overall reproductive role in a larger way. And so, of course, as soon as you see yourself belonging to a certain gender group, then you perceive your role as well in a certain way. You see what I'm trying to say? Because since traditionally societies have assigned the reproductive role to a woman, reproduction, I mean, in a larger, it includes everything. And so the males look at the women as having the sole monopoly of reproductive issues. And so there's a need for us to then address those issues. And then when we get into the very complex issue of gender orientation, which in itself would need another conversation of 2 hours or 1.5 hours, then it becomes even more complicated for those people, especially at when they realize in their adolescent years that they have a different gender orientation from the one that their physiology is telling his or her parents that that person has. So it's much more complex, and because parents look at the physiology of the baby and say, oh, it's a boy, oh, it's a man, it's a girl, all of us traditionally. And then the child starts growing and realizes that, or starts demonstrating different traits and characteristics, and to a point where at some point that individual decides, actually, I'm not even a girl, I'm a boy. I feel I'm a boy, even though they look like a girl, or they say, I feel like a girl, even though they look like a boy. And then that whole issue brings added complications to the access to family planning and reproductive contraceptives, because already the so-called traditional boy and girl already have issues, let alone when you bring in the added complications of, you know, added gender dimensions. So it's much more complicated than we can cover in this short time here.
One final question towards you, Ankita, before I ask Poonam to sort of summarize this, because she has a great pulse on the subject. Ankita, there's one question that's coming in saying, should education departments be responsible for this, you know, this entire dialogue? You know, do you think that's another way of looking at it? We keep talking about engaging with the Ministry of Women and Child, we're talking about the Ministry of Health. Should the Education Ministry come into this conversation and come in at a much early part? Dr. Qureshi made some very interesting points about how we tried to turn the terminology around, but there were just no takers for this conversation, as I said.
Okay. So if I got your question right, you're asking whether the education system should become more cognizant and active in providing information. Absolutely. I think, you know, some of the points that we've been discussing now about gender issues, these can be addressed through the education system itself, you know, creating a safe space where no matter what gender you are, apart from the gender binary, you know, the information that you provided is without stigma and without perceptions, you know, preconceived judgments about what your lived reality is, right? So I think that would also contribute to, you know, when these children who are in this education system that's more open in providing this information, when these very children grow up and they are in relationships where they have an open communication with their partner, then, you know, the disparity between how men take very little onus on family planning and the focus is mostly on women, that may be addressed, because a review of the NFHS data revealed that this gap in communication, you know, between men and women was maybe one of the reasons why there was so little, I don't know, responsibility or accountability on men to also, you know, take up some of the family planning burden. So that could also be addressed. And I think coming back to how society perceives the you know, gender binary, I think LGBT youth are there. The conversation around, you know, LGBT youth is completely non-existent. You know, when you talk about youth, first of all, you think of them as a homogeneous group, and then LGBT youth are completely excluded from the conversation because the country is still fighting to accept that these people exist. So I think some service provider bias there as well, you know, coming back to the point that I made earlier, should be addressed, that service providers should be sensitized to the fact that there are, you know, more identities, gender identities, than just men and women. And yeah, I think the education system can play a pivotal role in addressing all these judgments and preconceptions.
Poonam, would you like to add to that? Because I'm sure you've done multiple engagements with various government agencies. Are we not thinking of enough agencies or broadening the subject, or is it broad enough? We just need to go deeper with it.
So the broadening the subject of dealing with sexual orientation in this. Well, I don't believe we are quite ready, honestly, in the public health system. And we need to talk more about it. We did have India supporting a big understanding and focus in the Asia Pacific Conference. I remember ICPD brought this to light, an Asia Pacific Conference 10 years ago, when Mr. Keshav Desi Raju was the chair, and I remember that that's something that he really brought in. I don't believe that we have made enough effort to dialogue with the government. We haven't made enough effort to help people in the government understand the need to be inclusive in terms of sexuality. You know, the minute we begin to use the word sex, we are pushed 2 steps backward. So I think Argentina, and both Argentina and Ankita brought this out so wonderfully in the last 5 minutes. And I agree with Argentina, this needs a 2-hour discussion. So I would like to recommend to, not only us, all of us, and I'm really privileged, we are very privileged to be partnering this webinar with UNFPA today, and hopefully they will take the lead. And there are lots of wonderful health activists. I'm very, each of the health people I'm seeing on the list, Dr. Banerjee, Nadeem, Dr. Sharad Iyengar, and various people. I think together we can all think about doing some perspective building and sharing with the government. And there are 2 very exciting things I've learned, areas that I think we need to focus on. One is the whole discussion you raised on sexual orientation and reproductive health services, and then learning from Ankita, why do we ask whether young people are comfortable? Why not ask how, and we ask the healthcare providers and chemists to be comfortable? And similarly, it's not for people who, for those with different sexual orientations to make the health systems comfortable with us. It is the health system that has to make itself comfortable. And I think that many of us in this room today, the room of the webinar, the new norm room, can play a role. And Argentina, I learned a lot from how to deal with it the way you described it. So clearly an area which needs much more work than exists or we have done. So thanks, Mitali, for highlighting that.
Well, thank you all. I know we've completely run out of time, although this conversation could have gone on for longer. And I think what was amazing was that there was something for everyone to take away, whether you're a parent or a healthcare worker or a young adult. And I think, Poonam, in that sense, this webinar room is actually a safer space. Perhaps, a young person would not feel comfortable walking into a sex conversation in a physical space, but over here, we can talk about it as we should. My thanks to the panelists for, the deep sort of insight that you brought into this conversation and the empathy with which you talked about it. I hope those who need to listen are listening. My deep thanks to UNFPA, of course, for sponsoring this conversation, for being a part of it, to PFI for organizing it, and thank you to my organization, The Wire, for live streaming this. I hope for people who didn't get to be a part of it here and now, they can listen in and soak all of this in. So thank you all very much. It's been a great chat with all of you. I'll wind it down from here. Thank you to everyone who listened in and was watching this.
Thank you, Mitali.
Thank you, everyone.
So Argentina, I'll be chasing you now.